absolutely a neurosurgeon. Welcome to Medicine Boys. I'm going to be talking about stroke. So, what is a stroke? A stroke is an abrupt interruption of constant blood flow to the brain that causes loss of neurological function. The interruption of blood flow can be caused by a blockage leading to the more common ischemic stroke, or by bleeding in the brain leading to the more deadly hemorrhagic stroke. Ischemic stroke consists an estimated at 80% of all stroke cases. Stroke may occur suddenly, sometimes with little or no warning, and the result can be devastating. It is crucial that proper blood flow and oxygen be restored to the brain as soon as possible. Without oxygen and important nutrients, the affected brain cell are either damaged or die within a few minutes. Once brain cells die, they cannot regenerate, and devastating damage may occur, sometimes resulting in physical, cognitive, and mental disabilities. What are the risk factors for stroke? Although they are more common in older adults, stroke can occur at any age. Controllable or treatable risk factors for stroke include smoking. You can decrease your risk by quitting smoking. Your risk may be increased further if you use some forms of oral contraceptives and are a regular smoker. There is recent evidence that long-term secondhand smoke exposure makes increase your risk of stroke. High blood pressure of 140/90 Hg or higher is the most important risk factor for stroke. It is usually has no specific symptoms and no early warning signs. That's why it is important to have your blood pressure checked regularly. Controlling your blood pressure is crucial to stroke prevention. Okay, diabetes is another crucial thing. It is crucial to control your blood sugar levels, blood pressure, and cholesterol levels. Diabetes, especially when untreated, puts you at greater risk for stroke, and has many other serious health implications. So there are many others. Here are the uncontrollable risk factors include age. People of all ages, including children, have strokes. But the older you are, the greater your risk of stroke is. Gender. Stroke is more common in men than women, unfortunately. In most age groups, more men than women will have a stroke in a given year. However, women account for more than half of all stroke deaths. Women who have a higher stroke risk. Some research has indicated that women may experience and interpret stroke symptoms differently than men, causing them to delay seeking medical care and contributing to their higher stroke mortality rates. Hereditary and race. You have a greater risk of stroke if a parent, grandparent, sister, or brother has had a stroke before. Blacks have a much higher risk of death from a stroke than Caucasians do, partly because they are more prone to having high blood pressure, diabetes, and obesity. We need criteria in this. Prior stroke or heart attack. If you have had a stroke, you are at much higher risk of having another one. If you have had a heart attack, you are also at high risk of having a stroke. So, what are the symptoms of a stroke? The range and severity of early stroke symptoms vary considerably, but they share the common characteristic of being sudden. Warning signs may include some of all or all of the following symptoms: dizziness, nausea or vomiting, unusually severe headaches, confusion, disorientation or memory loss, numbness, weakness in an arm, leg, or the face, especially on one side, abnormal or slurred speech, difficulty with comprehension, loss of vision or difficulty seeing, and loss of balance, coordination, or the ability to walk. So, what are the effects of a stroke? The effects of a stroke depend primarily on the location of the obstruction and the extent of brain tissue affected. One side of the brain controls the opposite side of the body, so a stroke affecting the right side will result in neurological complications on the left side of the body. A stroke on the right side may result in the following: paralysis on the left side of the body, vision problems, quick inquisitive behavior, memory loss. A stroke on the left side may result in the following as well. Some of these things: paralysis on the right side of the body, speech language problems, slow cautious behavior, and memory loss. How are strokes treated? Finally got to this. Okay, so rehabilitation following a stroke may involve a number of medical specialists, but the early diagnosis of a stroke, its treatment, or its prevention can be undertaken by a neurosurgeon. Rapid and accurate diagnosis of the kind of stroke and the exact location of its damage is critical to successful treatment. Such technical advances as the use of the operating microscope, microsurgery, and the surgical laser have made it possible to treat stroke problems that were thought to be inoperable a few years ago. Ischemic stroke is treated by removing obstruction and restoring blood flow to the brain. One treatment for ischemic stroke is the FDA approving drug, tissue plasminogen activator (TPA), which must be administered within a 3-hour window from the onset of symptoms to work best. Unfortunately, only 3 to 5% of those who suffer a stroke reach the hospital in time to be considered for this treatment. This medication carries a risk for increased intracranial hemorrhage and is not used for hemorrhagic stroke. Hemorrhagic stroke usually requires surgery to relieve intracranial within the skull pressure caused by bleeding. Surgical treatment for hemorrhagic stroke caused by an aneurysm or defective blood vessel can prevent additional strokes. Surgery may be performed to seal off the defective blood vessel and redirect blood flow to other vessels that supply blood to the same region of the brain. Endovascular treatment involves inserting a long, thin, flexible tube, a catheter, into a major artery, usually in the thigh, guiding it to the aneurysm or the defective blood vessel, and inserting tiny platinum coils called stents into the blood vessels through the catheter. Stents support the blood vessel to prevent further damage and additional stroke. The Mercy Retriever, approved recently by the FDA, is a corkscrew-shaped device used to help remove blood clots from the arteries of stroke patients. You don't really have to worry about this, but recovery and rehabilitation are important aspects of stroke treatment. In some cases, undamaged areas of the brain may be able to perform functions that were lost when the stroke occurred. Rehabilitation includes physical therapy, speech therapy, and occupational therapy. Physical therapy involves using exercise and other physical means, example, massage, heat, and may help patients regain the use of their arms and legs and prevent muscle stiffness in patients with permanent paralysis. Speech therapy may help patients regain the ability to speech, and occupational therapy may help patients regard independent functions and relearn basic skills. Thank you for listening. I'm Mark Tully. Goodbye.